So this is kind of what would, oh, that's right. This would be just what you would do if you got a broken arm or an ankle, and it's going to take a picture of your chest. But you can also get an MRI done, which is going to show them inside your body and what it looks like. And this can be a much more better picture, and they can see more things, and they can take many snapshots throughout the beat of your heart. So them doing x-ray, they can take one picture, and then you're kind of done. You don't usually take a ton of pictures of one thing. But with the MRI, they can take as many pictures as they want in a short amount of time with you stimulating certain things. You could hold your breath for a while, you could breathe all the oxygen out of your breath, and then wait, and they're going to take more pictures then. And then you can also do an electrical echocardiogram. So this is what an ultrasound, just like how pregnant women do an ultrasound of the baby, they also do ultrasounds of the heart, and this can show them how your heart is working, blood flow, and this is going to show them what is really going on inside your heart. So these are how they would diagnose you, and when you go to the doctor if you have arrhythmia. They could do all of these or none of these. I have had all of these done, but an MRI might not be needed if they see everything they need to see. But it really depends case to case. So then you go down to treatments, and so this is going to vary if the severity of your heart arrhythmia. Having a little heart arrhythmia but nothing severe, you could need none. You might just be able to live your everyday life how you have been without any treatment, which is what I do. I don't have any problem besides monitoring. An implant. You could get a pacemaker. So a pacemaker is a small device. It gets implanted by your collarbone, and it sends electrical devices to the heart to make it beat properly and help it control the beat and pattern. So this is what a pacemaker looks like, and it's very small, as you can see, and you really wouldn't be able to tell if someone had a heart monitor until you felt like their collarbone. I mean, not a heart monitor, a pacemaker, because it's small. It's not gonna show really. And then you could also implant a defibrillator. And this is going to send a shot to the heart to correct the arrhythmia. So the pacemaker is trying to prevent it by controlling the heartbeat, and this is going to correct it when it happens. And then the final one is radio frequency ablation. So this is a catheter that sends radio frequency energy to the area of the heart tissue, and it destroys it, so then you won't really have arrhythmia anymore. But with all of these, you're going to need to get monitored in case something changes. As a child, your heart is going to grow and change. So the treatment they give you might not work later in life if for some reason your heart changes. So you have to get monitored. And then this is what a defibrillator looks like. So this one is also small, and that's what it's going to do. So now we know what heart arrhythmia is, what causes it, the 4 types, how you treat and diagnose. Do you guys have any questions? Yes, Caitlin?
Could a heart arrhythmia come to becoming worse than it was before?
Yeah, it could, because your heart could change as you grow. or you might have something that would stimulate it to change. That's why doctors want to monitor you if you have heart arrhythmia. So if it's not very severe, it could be 1 or 2 years between appointments, or it could be you need to go in like every 6 months. They just need to monitor your heart rhythm. So, yes, Jessica.
Can you grow out of heart arrhythmia? Like, could you have it like when you're little and then not have it when you're older?
I've never heard or read anything about that. Heart arrhythmia is most likely going to stay with you your whole life. It's not going to leave unless something changes in your heart, which would be rare and not really happen. Yes, Isabel?
Could you have multiple heart problems, like arrhythmia and something else that affects the arrhythmia?
You could, yeah. Sometimes when you're born, your heart hasn't fully developed, and so you could have a chamber that has not fully developed, which could cause another problem like arrhythmia, or you could have holes in your heart, which would not really allow your heart to fully function, which could be caused by your heart not developing completely, which could have other problems. Any other questions? Okay, so now we're going to flip over the questionnaire I gave you earlier and going to take the same questionnaire and see if your answers improve. Now that I have completed the questionnaire again, let's see if your answers have improved. So, the first one in 100 babies born in the U.S. have a heart defect. What did we say? True. The heart has 6 chambers.
False.
4. And what are they called?
Right ventricle
And
and left right atrium.
Very good. Chest pain is a symptom of having a defect.
True.
True. And what are other symptoms of having a heart defect? Do you remember from your lecture notes?
Dizziness,
Yeah.
Feeling faint, thinking you're in pain.
Yeah.
being short of breath.
Short of breath.
Like sweating, being pale.
That's very good. Scientists have not developed any new ways to fix heart problems in the 21st century. Yes.
False.
That is correct. Study the heart is cardiology. Yes, Isabella?
True.
That is correct. Heart defects are birth defects.
True.
True. All heart defects are found at birth. Could you find all of them at birth?
False.
False. Yeah.
You could live with something if it was small.
If it was a minor heart problem, you might not know until you're older. Or you might find out a few weeks after being home, your parents could notice something. Arrhythmia is when the heart doesn't beat like a normal heart.
True.
And how many types of heart arrhythmia are there?
4.
Very good. The heart is the center of a respiratory system.
False.
That is false. What does it somehow? What does it regulate?
Regulatory system.
There you go. Heart transplant is never needed to fix a heart problem.
False.
That is correct. Some hearts have holes in them that are not meant to be there. Yes, Isabella? True. That is correct. And heart doctors are called cardiologists.
You skipped one.
Oh, thank you. The sinus node creates a heartbeat.
True.
True. Heart doctors are called cardiologists.
True.
You may never know the specific cause of heart defects.
True.
And
You
the last
skipped another one. Artificial
Oh,
hearts.
you may never have artificial hearts to replace a failing heart.
False.
That's false. We already have one. If you have a heart defect, it cannot be fixed completely. It will never be perfect. And we said that was debatable because some heart defects might not always need to be fixed at all. Some may get replaced by an artificial heart or heart transplant. So now that we did better on that, I'm just going to do a quick another round of the tennis racket, and we'll see if you guys can pick up on which one I'm stimulating. So I'm just going to start with the regular. And now, what's this one?
Regular.
Okay. And, oh, sorry, that's a regular one. Okay.
Regular.
Fast one.
Cardia.
Yeah. And then this one. Okay, that's very good. That concludes the lesson. Thank you all for listening and learning about heart rhythm.